like to welcome everybody to the 2022 legislative preview presented by Voices for Utah Children. We're going to go through different policy areas and bills that we're tracking, and then wrap it up with some ways that you can get involved during the current legislative session starting on January 18, 2022. First, I'd like to introduce our Senior Health Policy Analyst and Deputy Director, Jesse Mandel.
Thanks, Mo. Hi, everybody. I'm very excited to talk about some of the bills that we're going to be watching and engaging with this legislative session. First up is a bill that is our top priority in the health space for this session, which will be building on some exciting momentum from the previous session from 2021. And this is a bill to cover all Utah kids. Utah has one of the highest rates of uninsured children in the nation, and we've seen an alarming increase in the number of uninsured children over the last couple of years. So this is an important bill that will help us get kids back on track and reverse the trajectory we've seen affecting kids and families over these last couple of years. Sponsored by Senator Luz Escamilla, who's been a tremendous champion for this bill and building on just some great work that happened previous session to lift up this issue. We feel like this is the year to cover all kids and to get this bill passed. It will do three critical things for Utah kids. One is it will remove barriers that currently deny some children the ability to enroll in CHIP and Medicaid. And so by removing these barriers so that all children across the state, regardless of where they live, their immigration status, their the language they speak, that all children will be able to enroll in health insurance. This will be an incredible step forward for Utah kids and will go a long way to help families across the state. The second critical thing that this bill will do is that it will also enact a policy of 12-month continuous eligibility. This is something that has been a top issue for Voices for Utah Children over the years and ensures that children enrolled in Medicaid will be guaranteed 1 year of continuous coverage, regardless of temporary bumps or changes that may affect their parents' eligibility over the course of the year. This guarantees that kids can just have that year of continuity and streamlined care. And lastly, this bill will also ensure targeted outreach because we know that many children are still unaware of their health insurance options. We made some great headway last session. This bill will build on that and make sure that once the rules change and that more kids are able to get enrolled that have previously been denied care, that they will be able to learn about their options. And so this bill is really important to help families learn about their options and know about changes in the Medicaid CHIP system that would enable them to be able to access coverage. So we're really excited. We'll be sending out lots of information about this. I know Syriac will be talking about this bill a little bit more as well, because we really feel like this is the year to get kids coverage over the finish line and make sure that Utah covers all kids. A second bill that we are working on and following very closely is sponsored by Representative Lesser, who has been another champion and an advocate for maternal mental health and maternal justice in our state. This bill will address gaps in coverage that pregnant people experience during the prenatal period and also the postpartum period. And as we all know that coverage is incredibly linked to mental health. So if you're not covered, then it's harder to access consistent mental health services. And so this bill would address the maternal mental health crisis that we are experiencing in our state by creating continuity and coverage for women and pregnant people prenatal through postpartum. What this bill would do is it would increase the threshold for Medicaid pregnancy because pregnancy does not enable you to qualify for a special enrollment period in the marketplace. So it is possible for individuals in our state to go their entire pregnancy without coverage because they weren't able to access the marketplace. Second, this bill will address the Medicaid postpartum period. Medicaid postpartum coverage only goes for 60 days, but this bill would extend that for 12 months postpartum. And it will also address people that might fall through the cracks when they're transitioning from Medicaid to the ACA marketplace by putting in some safeguards and creating a warm handoff for people to access the marketplace if they're eligible for the marketplace after pregnancy and after giving birth. So it is unfortunate we still have many in our state who are experiencing breaks in their coverage during this vulnerable period, or who are just going their entire prenatal or postpartum period without coverage. But this bill would address that and ensure better care and also better connections with mental health services. So very excited to see this bill move forward and appreciate Representative Lesser's terrific work on this. Finally, bills that we are going to be watching that are continuing to come out that are also unnumbered are just bills that are going to be undermining, bills that we're concerned about that are going to be undermining public health authority. And we're continuing to see that. We saw that last session. We're still seeing some bills this session. And really, as we are still in a surge, still experiencing the pandemic, still trying to keep our kids and families safe, it's so important that we ensure that we have a strong public health care system right now. And bills that potentially limit the ability of our public health experts and our public health officials to address and move forward with getting people vaccines, getting people connected with safe care and safe public spaces. That really limits the ability of our kids and families to stay in school, stay healthy and thrive. And so we will be posting information about that and just keeping an eye on those bills too, because having a strong public health care system and public health care infrastructure is important for kids and families in our state. So we're very excited about all these bills. I'm going to pass it over to my colleague, to Senior Health Policy Analyst Siriak Alvarez-Valle, to talk more about the 100% Kids Cover All Kids bill and other bills that she's going to be watching during this session.
Thanks so much, Jessie. And I'm going to start off with talking a little bit more about our Cover All Kids bill. Just to reiterate, this policy is inclusive of immigrant families. We know that the past couple of years before the pandemic started, there were a lot of issues with public charge and families being afraid of seeking services and programs that they were eligible for. And we saw a rising number of uninsured children, including one of the highest rates of uninsured Latina children. And so this bill will be important in fighting and ensuring that all kids, regardless of where they live, whether they are in an urban or rural area, whether they are, regardless of their immigration status or their income level, that they are all able to access healthcare. And so we will be supporting and working on that bill with Senator Luz Escamilla, and we are really excited and hoping that we can continue to lower our uninsured rate even more, especially during a public health emergency. The second bill that I want to talk about is our community health workers optional certification bill that we are working on with Senator Luz Escamilla. This bill is really important because community health workers have been at the front line of the pandemic, fighting the pandemic and ensuring that families and community members are able to get the resources, programs that they need, from isolation services to knowing where to get testing to even navigating the healthcare system. And this bill would create a voluntary certification pathway for community health workers to support the workforce and ensure that there is some protection to the workforce, and also support the validating their work and opportunities for greater funding for community health workers. There are a number of requirements that would ensure that they have the right competency-based curriculum training, skills, including advocacy, outreach, capacity building, navigating community and coordination, education and facilitation, and professional conduct. and having a basic understanding of medical confidentiality requirements such as HIPAA. It would also require community health workers to have a certain number of hours that they are involved in their community, have a certain number of competency-based curriculum training that they've done, and an opportunity for those who have been community health workers for years before the optional certification to grandparent into the program. And so we are very excited to support this work and support the work of community health workers who have been at the front line of the pandemic. And we will also be doing a advocacy day on the Hill on January 26th, Wednesday, January 26th from 3:30 to 5:30 in support of this bill and in support of community health workers. With the pandemic and the rising number of cases, we are keeping an eye out and making sure that when we do this, we do it safely. And if there are any changes, we'll make sure to update you all on those changes in the coming weeks. But for now, we are hoping to continue doing this in person and supporting this community health worker optional certification bill. In addition to these two bills, we are also keeping an eye out on any of the bills that have to do with immigrant families or immigrants in our state to make sure that they are supporting our immigrant communities and not harming our communities. There are a couple of bills that would support greater opportunities for occupational licensing and multicultural students within schools that we are keeping an eye out. And we will have an update on those bills in our bill tracker once the bill numbers are released. So with that, I'm going to pass it over to Matthew Weinstein.
Thanks so much, Syriac. So I'm Matthew Weinstein, and as you have noticed and will notice as we continue this presentation, all the things that we're proposing have a price tag. There are many terrific ideas that we're proposing here that will do a lot of good, and many of them even pay for themselves over time, but there is an upfront investment that's required. And so that's why my job at Voices for Utah Children is to keep an eye on fiscal policy, to keep an eye on the state's overall money picture, the public revenues. And so what I'll be talking about for the next few minutes is two of the areas, the way we break that down policy-wise. The first is the overall revenue sufficiency picture. Do we have sufficient resources available through state government, through the taxes that we all pay, to make the investments that we need to make in Utah's future, in the next generation, in our children and grandchildren? The biggest challenge that we've noticed in this area is that when we look back historically, we see that we've actually been passing tax cuts averaging $100 million every year in new tax breaks for decades, for the last 35 years at least, which now for the fiscal year 23 budget that's going to be debated in the legislature in the session that begins this month, that's $3.5 billion that's not available to make these investments in the next generation. And of course, the natural question is, well, do we even need that money? And so we've researched that, and we found that there are actually well over $5 billion of unmet needs, urgent unmet needs in so many different areas. We heard Jesse and Syriac talking about healthcare needs. We're going to hear some others of our colleagues talking about needs in terms of juvenile justice and early education and other areas, as well as ensuring that we're treating our immigrant communities fairly and inclusively. So, and those aren't the only areas. So if you click on the link there or scan that the link there, you'll be able to see that we actually have identified well over $5 billion of urgent unmet needs in many, many different areas of state responsibility that affect all of us, including things like air quality and infrastructure, transportation access, disability services, areas that affect all of us, affect our children, and have a key role to play in determining the quality of life and standard of living for the next generation of Utahns. So that's where we're running on a theme here of invest in Utah's future, not tax cuts, that we've done our share of tax cutting. Now's the time to shift our focus to investing in Utah's future, investing in the foundations of our future growth and prosperity. And so you can read about that on that link on the left side of the page in front of you. Now, at the same time, we do focus on the question of tax fairness, and we know that our legislators are in the habit of doing tax cuts every year. We're realistic about that. And so we know that if they're going to pass more tax cuts, it's important to keep in mind that not all tax cuts are created equal. There are big differences depending on which taxes you cut and whose taxes you cut if you're going to do tax cuts. The main taxes that we've been cutting in recent years has been the income tax rate. We cut it from 7% to 5% under Governor Huntsman. Under Governor Herbert, we cut it from 5% to 4.95%. But the problem with cutting the income tax is that that's the only fair tax that we have. It's the only tax that we have that isn't a regressive tax, unlike the sales tax, the gas tax, the property tax, which are most of the taxes that most of us pay. The income tax is the only one that actually lines up with Utah's income distribution. It follows what I call the 3/5, 1/5 rule. 3/5 of all income is earned by the top 1/5 of taxpayers. 3/5 of the income tax is paid by the top 1/5 of taxpayers. So if we cut the income tax rate, we're making our tax system more regressive. We're shifting the taxes off of the highest income Utahns who earn most of the income onto average and below average income Utahns who could use a break in a lot of cases. So that's why we're saying to the legislature that if you do have to cut taxes, please consider an earned income tax credit. This is a terrific program established at the federal level under President Ford, expanded first by President Reagan, that is targeted to low and moderate income working families that must be working in order to qualify for it, to let them keep more of what they earn. So they're still paying taxes, they still have skin in the game, but they get a break because, you know, right now our overall tax system is regressive, and the lowest income Utahns pay a higher tax rate than the highest income Utahns, you know, when you count everything. So it would also help address the labor shortage that we have in Utah by drawing more workers into the workforce. And we could make Utah the 31st state with its own version of the earned income tax credits. You can learn more about that at utahfamilytaxcredits.org. I'm now going to turn it over to my colleague, Martin Munoz, to talk about the work he's doing in the area of juvenile justice.
Good afternoon, and thank you for joining us. The first bill I wanted to discuss is in the realm of juvenile justice is HB 55, Juvenile Justice Service Amendment. This bill addresses the Division of Juvenile Justice Service, JJS. The bill provides JJS with rulemaking authority to establish qualifications and conditions of service provided to minors who are terminated from JJS custody. The opportunity this bill is going to offer is that allowing JJS the opportunity to assist youth who are exiting the custody of JJS and assist them with transitioning back out into society, especially with youth who are lacking a support system, a family structure. So it's a really good amendment, or a good bill that we are supporting. The next bill, as it's shown here, it's not numbered yet, and we are waiting to hear. But it is the Juvenile Justice Fines and Fees. And our colleagues out at Utah Juvenile Defenders Attorney are the leads on this bill in helping and are working with the sponsor, Representative Weiler. The strategy is that fines and fees are discriminatory and are shown to have weakened family and family ties, the anxiety that can be put on, the pressure to pay a fine, which can also lead to recidivism. So it's definitely a good bill that we are going to keep an eye on, support, and help out where we can to get through the legislation and passed. The second bill is a juvenile expungement amendment. Again, not sponsored or not signed yet, but it is sponsored by Representative Snow. And here again, our colleagues at Utah Juvenile Defenders Attorneys are really taking the lead on this. We're definitely in support of it, and we'll be helping them. The premise of the bill is to create an automatic expungement list for any juveniles who are found to of a non-judicial adjustment, found guilty, if a statute of limitation is passed on a charge. People tend to believe that the juvenile record is sealed and not available after 18. That's not correct in Utah. So it's important for a lot of these juveniles to get these records expunged. The other advantage of creating the automatic system would assist in the list would be, these are the opportunities where an expungement can be without charge, with the cost, which it's a process that takes some fees to file and everything, fingerprints. So definitely a good bill to keep an eye on, support. We'll be assisting, as I said before, is similar with the fines and fees bill, helping out where we can, but definitely in support of. The next area within the juvenile realm is student equity and fairness. HB 11, we are definitely opposing this bill. This is the student athletic participation bill sponsored by Representative Brooklyn. This bill addresses the student athletic participation in gender designated sports and public education. And it's critical that we oppose this, because we feel like that HB 11 creates an unnecessary barriers to healthy participation in school athletic programs, as well as inequities and challenges for students. Additionally, this bill would add discriminatory practices in schools that alienate children, potentially pushing them into misconduct. We were concerned with the process and getting this looked at closer, and working, hopefully not seeing this type of bill to be passed. The next bill that we are definitely in support of as well is the HB 30. This is the Student Tribal Regalia Use Amendment, sponsored by Representative Romero. And this believes it's a beautiful opportunity for our students who are descendants of Native tribes to be able to present their customs, their traditions, and their heritage at their graduations without concern of being told they couldn't. So we are definitely support. We think this is a great opportunity to allow for our Native students to really represent themselves, to be their whole self, and to express their culture and their family traditions with their high school graduation. The next bill that we hope to be working and helping and getting support and getting it through the session was last year's SB 80, which was sponsored by Senator Kitchen. This is the Utah Anti-Discrimination Act Amendment, but as was also known as the Crown Act. It creates a respectful and open world for natural hair. This bill would have amended the Utah Anti-Discrimination Act to protect unchangeable traits and hairstyles like braid locks, afro curls, and twists historically associated with race. We're still waiting to hear more on the bill. Still waiting to see when this a draft or any information on the bill. So we'll definitely keep everyone updated with our bill tracker on this, and hopefully we can get it passed this year and through the legislature. Thank you, and I will pass it on to Anna Thomas.
Now, thanks, Martine. I will be talking about some early childhood care and education efforts that we are going to be supporting at the legislative session this year. The first one, our big one, is kind of a bookend to the 100% Kids Covered campaign that Jesse opened up talking about, is a full day kindergarten expansion bill that will be sponsored by Representative Steve Waldrop from the Weber County area. This is the culmination of several years of work so far by a number of different groups, not just Voices for Utah Children, but United Way of Salt Lake, Utah PTA, our great partners at the Utah State Board of Education. This legislation is not numbered yet, but the goal will be to fund full day kindergarten over the course of 3 years in the districts and charter schools that want to offer it for the parents who want their children to participate. So the 3-year timeline will give school districts and charter schools time to figure out the logistics of facility space and available teachers and all that stuff. And in the meantime, slowly building this into our state budget so that kindergarten can be funded the same way every other important grade is funded in our K through 12 system. If you want to learn more, I highly encourage you to go to the Utah Full Day Kindergarten Now Coalition's website that is displayed right here. You can sign up for more information, and you can even record a little video talking about why you personally support full day kindergarten expansion so that we can really meet the needs of Utah families that want to participate, and so that parents have a real choice in the kind of kindergarten programming that their children can enroll in. In addition, we're supporting several childcare bills that are aimed at bigger systemic improvements to Utah's very beleaguered childcare system at the moment. There are some smaller administrative changes and then some bigger efforts to improve access to childcare and raise the profile of the childcare crisis that parents are facing right now in Utah. So HB 15 is from Representative Susan Pulsifer, who has worked with a variety of stakeholders for 6 months now, more than 6 months now, to develop this bill. It has a number of different provisions in it, most of which are incentives to have folks include childcare development in other community development projects, such as community reinvestment projects and also transit-oriented development. There's also a cool grant program that will incentivize businesses, private and also public agencies like school districts and county agencies to offer childcare to their employees. So form some collaborative relationships between childcare providers and employers to meet the needs of working parents. There's also a provision in there that will assert that the state is responsible for childcare licensing, and that it is not the realm of cities and counties to make rules about childcare licensing, such as determining how many children can be in a single location with one adult, and other local red tape that restricts the amount of childcare access our current providers are able to give to the families that they serve. So that's going to be a big one. We're very supportive. The next one that we are going to be supportive is not yet numbered, but Representative Ashley Matthews, who is a great champion of childcare reform during the last legislative session, despite being a very new legislator, will be pushing legislation to create efficiencies in how childcare providers are paid for children who receive federal childcare subsidies through the state. So current practice before COVID is sort of antiquated, inefficient, and creates additional red tape and bureaucracy for childcare providers who serve low-income children who receive childcare subsidies. So this would, post-COVID and going forward, ensure that the government pays subsidies in the same way that private pay families pay subsidies to ensure stability and honest treatment of childcare providers who are serving low-income children and their families. And I don't want to forget, Representative Matthews is also going to be asking for a cost of care study from the legislature that will discuss not just the market rate of childcare, how much people are currently paying for childcare in different areas of the state, which we all know is pretty exorbitant for a lot of low and middle income families, but the true cost of providing childcare, which, believe it or not, is even higher than the current costs that families are paying. This is really important for our state leaders to understand how much of the childcare system is being subsidized by the providers through making very slim margins, undercharging, not being able to pay themselves a living wage. So this is going to be very important going forward as we pursue bigger and more dramatic reforms, which is really what our childcare system needs. Doing a little bit here and a little bit there is not going to provide the relief that Utah families need and the childcare of high quality that all Utah kids deserve to have access to. So for that bold reform needed in the future, we need to have a better understanding of what the true expenses are in the provision of high quality childcare. And finally, a nice bill from Representative Steve Handy, who has been working on this for a couple of years to ensure safe lead levels in school and childcare centers, and also to provide funding to help those locations actually do the mitigation necessary to meet those safety requirements. I also love this bill because it puts school and childcare centers right together. And as I often say, school is childcare, childcare is school. Really, children need to be safe and healthy and have a positive growing learning experience in all those environments without so much distinction going forward. And just a quick mention too, this may or may not be relevant during the legislative session, but while we're doing some of these small fixes at the state level, there are some opportunities being presented by Congress, or at least they're being discussed by Congress, that could really help incentivize childcare reform in Utah, coupled with greater access for preschool opportunities for parents of 3 and 4-year-old children. So this would be a pretty big shift in how we approach these early learning opportunities, but really also provides the opportunity for the kind of dramatic overhaul we need for our childcare system so that it works much better for parents, for the children who are in care, and for the child care professionals who provide that care to those children day in and day out and have been doing it throughout the entire pandemic. So that will be happening parallel to what's happening at our state legislative session, and that may come up in conversations with our legislators. If you are interested in any of these topics, if you are a parent with children who is really inspired to work for early care and education reform, if you're a child care provider or a preschool teacher, or just an early education and child care policy nerd like myself, we are hosting a training, an advocacy training on Saturday, January 22nd. It will have an in-person component up at the state capitol, and it will have an online component for people who prefer not to join in person or who can't join in person because they're working or providing childcare at that time. So you can go to our website at utahchildren.org, and there's information on how to register for that advocacy training there. And with that, I will turn it back over to our director, Mo Hickey, to talk a little bit about how you can stay up to date on how these bills are proceeding as we move through the legislative session this year.
Thanks, Anna, and thanks everyone for those updates. As you can see, this is a moving target, as it normally is this time of year. Bills are being filed, bills are being numbered. Even in the middle of this call, I was getting updates of new bills that have just gone into the system. So this year, aside from the normal channels, which we ask you to follow on our website or on social media, we will have a live bill tracker on the website, utahchildren.org, and click on legislative, and you'll be able to go to the bill tracker. The nice part of the bill tracker is you'll be able to choose areas that you're interested in following. So as Anna said, if you're an early childhood nerd, then you can follow early childhood. You can follow all the bills we're following. We will have whether or not we support, oppose, neutral on the bills. But what I'm really excited about is we really need citizen engagement during the legislative session, especially this year when the pandemic is still going forward and in person could be difficult for some people. This bill tracker will allow you to click immediately to contact your legislator. You put in your address, it will populate who your legislators are. So it takes out the research piece of finding out their emails, et cetera. And then you can populate the note and send it to them directly, specific to that bill. So we encourage everyone to sign up for the list. You'll get updates as we update once you sign up. And please contact your legislature. That is the most important piece that we could ask. They do respond to people who they represent. And the nice part about this system, as I mentioned, is you'll be contacting your representative directly. So stay in touch, stay tuned, and we're about 9 days out from the start of the session, and we will be updating on a regular basis. Thank you for joining us.